Us too.
That's mine. No, that's mine. That's my mark.
That's your head down. Sorry. Oh,
Thank you.
very dramatic. Okay. We good to go?
Yep.
Well, good morning, Queensland. Today I can report 20 new cases. Thankfully, 19 of these are overseas acquired and not in hotel quarantine yet. What they are is a crew of 21 on the MV Sanyu, a bulk carrier vessel. We were advised that a number of the crew on board were unwell, and health workers went on board yesterday and tested them, and 19 of the 21 have come back positive so far. And I'll get Dr. Young to just talk about the logistics of how we will be managing that crew to look after their health going forward. In addition, we have one confirmed case in the community. This is an individual who had been in hotel quarantine, had travelled from the Philippines, is a Australian resident who lives in Western Australia, but had travelled back to Brisbane from the Philippines and left quarantine on the 17th. He had all of his tests while in quarantine were negative, however has become unwell and had been tested on the evening of the 26th of July and has come back positive. It is deemed that he has been infectious in the community since the 22nd of July. This individual has been residing at the Roma Street City Backpackers during this period. This puts us at 42 active cases in Queensland. We've had 17,816 tests in the last 24 hours, which is fantastic. So please, Queenslanders, keep up that level of testing. And we had 12,774 vaccinations. We've now got 2,321 people quarantining at home as well. We can announce today, based on the decisions made by the Victorian government and the South Australian government yesterday, to lift their lockdown, but to continue to have a very high level of restrictions in those states, that we will continue to declare Victoria and South Australia as hotspots, which will mean that there are only certain eligible people to come to Queensland. So those who are Queensland residents returning to Queensland, or those people who have applied for and been granted exemption, including certain particular essential workers. For people who are currently eligible to travel to Queensland from 1 a.m. on Friday, we will allow these people to quarantine at home instead of hotel quarantine. Of course, with all of our home quarantine, there is significant compliance and enforcement of compliance. And if anyone is found to be in breach of home quarantine, not only can they be fined, but they also can be required to go into hotel quarantine. Of course, for these people who are already allowed to come into Queensland, from 1 a.m. Friday, you must have a suitable residence to quarantine in. So if you were going into a hotel somewhere outside of hotel quarantine, that wouldn't be a suitable residence. You must have a home or appropriate residence, and we will allow for you to home quarantine. I'll now hand over to Dr. Young to just talk about particularly these cases today, the crew on the ship, but also importantly this new community case that we have.
So yes, we have two separate issues today. The first is that the bulk carrier, the Sanyo, came into the Torres Strait waters on Monday and asked for a pilot, and then disclosed that they had a lot of sick people on that ship. So there were 21 crew on that ship and a lot of them were sick. So we sent out nurses onto that ship who tested them all through yesterday, and we got those results late last night, and 19 out of the 21 are positive. So then we worked very closely, as we always do, with MSQ MSQ, who are the lead for this, Maritime Safety Queensland, to organise the best possible response to keep the crew on this ship safe, to keep the ship safe and to keep the people of Queensland safe. So it's been organised that that ship will steam around to Weipa, and it should be, if it hasn't arrived already this morning, it should be arriving fairly soon into Weipa. Then we will organise to take those sick crew off that ship, maintaining enough crew on the ship to keep that ship safe, and we work through MSQ to sort that out, and then we'll bring those sick crew down to Brisbane to be managed in one of our COVID facilities in Brisbane. So all of that is happening as we speak. Now, that ship came originally from the Philippines, and all the crew, I understand, are from the Philippines. Now then, the second issue is that we have a gentleman who was in hotel quarantine at the Quest Hotel in Brisbane, left hotel quarantine after 3 negative tests, then subsequently became unwell, so went to the Royal Brisbane Women's Hospital Emergency Department, where he was tested late on Monday night, and that test came back late yesterday as positive. So he's been infectious in the community since the 22nd of July. Now, he's been staying at that Backpackers Hotel on Roma Street. So we'll now go and contact trace the people in that Backpackers Hotel and other people that this gentleman's been in contact with. Now, this is our 13th incursion of the virus into the community in Queensland over the last 6 weeks. So it is becoming increasingly concerning that we are having these repeated incursions of the virus into Queensland. So thank you very much to those more than 17,000 people who came out and got tested yesterday. This is what we must continue to do going forward. And it doesn't matter where you are in the state, because as we can see, these backpackers, when we follow up with all of them, could have gone anywhere in the state. Or the people, given that we don't necessarily have backpackers at this point in time, the people who have been staying in that hotel could have gone anywhere in Queensland. So it is really, really important, please, anyone in Queensland, any symptoms at all, come forward and get tested. The second thing is masks are critical. We know they make a difference, and I'm sure they've played a role in why we've not had widespread community transmission from any of these 13 incursions of the virus. So that's really, really important. But most importantly of all, if you are sick, please stay home and immediately get tested. Then I also want to thank those more than 2,000 Queenslanders who are in home quarantine and I know are following the instructions and staying at home. That is critical because you are the highest risk to our community. You have been deemed a contact so that you need to be in quarantine, and we've put you in your home. So that's why we're going ahead on Friday, as the risk in those 2 southern states where we've declared hotspots in South Australia and Victoria, as their risk decreases, which is excellent news, they've removed their stay-at-home orders, then we've made a decision that Queenslanders who are coming back home to Queensland, that we think that we can safely allow them to quarantine if they've got a suitable home at home for the 14 days. So anyone arriving into Queensland who's able to come into Queensland, because those 2 states are still declared hotspots, can go home if they've got a suitable home and quarantine at home for 14 days. So we'll work through how that works. But it isn't about lifting our border restrictions. Our border restrictions are exactly the same. We still have those hotspots declared, and we'll review that as Victoria and South Australia review their restrictions. So both those states have decided that although they've removed the stay-at-home orders, they still have significant restrictions on what people can do in those 2 states. So while they have those significant restrictions, we'll continue to maintain our tight domestic border with those 2 states. Thank you. Oh, one last thing. Given that we are seeing increased numbers of cases across Australia. So in New South Wales, there are now well over 2,000 cases related to their latest outbreak, related to that limousine driver on the 16th of June. It is very, very important that we are not complacent in Queensland when it comes to vaccination. That may be what makes the difference going forward. So if we do have an outbreak in Queensland, we can see in New South Wales the people who have been protected are the people who have been vaccinated. So it is really important that if you are vulnerable, that you get vaccinated. And particularly, we know that the biggest vulnerability is older age. So anyone who is 60 years of age or older, if you haven't already gone and got vaccinated, now is the time to go and immediately do it. So go and see your GP or go to one of the vaccine clinics, particularly that the Commonwealth is running, or one of the pharmacies, and get your AstraZeneca dose. If you've already had one dose, it's really important. We know that the efficacy steeply increases with that second dose. So if it's 12 weeks since your first dose of AstraZeneca, make sure you go and get the second dose as soon as you can when you reach that 12-week interval. Thank you.
Morning. So another very busy day for us operationally in our COVID response here in Queensland. Yesterday, 4,286 vehicles intercepted at our road borders, 54 refused entry and 2 persons placed into quarantine. We intercepted 188 heavy vehicles. We saw a large number of them turned around yesterday, 51, and identified there was a problem with the system in that they were applying for the wrong passes. Most of those were worked through and able to get through once they had the correct pass. Nonetheless, there were 13 who had attempted to enter with incorrect passes. At our domestic flight areas, so arrivals there, saw 530 persons processed, 11 refused entry and 81 placed into quarantine, and we had 136 international arrivals. Now, as the Chief Health Officer has just said, it's really important that we understand our responsibilities in the COVID area in this state. People have been fantastic all through this response. It has been a long time, we get that, but it is not over. And we're still seeing people not wearing masks. So 27 masks were handed out yesterday by police, and 2 persons were fined for not wearing masks in Brisbane, including 1 person on a train, after beginning the option to comply with police and not doing so. So first of all, carry a mask and wear it. Secondly, when given the option to wear one by police, put it on. I think that's a very wise thing to do. We saw another further 7 pins on top of those 2, so penalty infringement notices. 1 person had attempted on 3 occasions to get across the border at firstly Gundawindi and then Texas. Despite giving some very good advice by the police, kept turning up and in the end had to be fined for trying to get across the border inappropriately. And we had 2 persons giving false declarations coming out of Victoria that were fined at our road borders as well. Similarly, as you know, we've taken action in relation to the investigation into the people that had travelled from Ballina, the flight attendant and her associate. It's very disappointing, the behaviour we've seen in that. It's shown no regard for our community. So we took enforcement action. The flight attendant has been fined $4,135 for assisting the male person to inappropriately come across the border without a pass. So he has been fined for that aspect, for not having the pass. Also for inappropriately using someone else's QR code in checking in somewhere, which is an offence. And finally, not wearing a mask when positive with COVID in hotel quarantine and being given a direction and refused to obey it by police. So that's another fine. So a total of $9,648 of fines for that person, which is entirely appropriate. Thank you. Look, as I mentioned yesterday, what we do is allow our officers to make the operational decision around how that prosecution action should be taken. They are trained to do that. They assess all the factors in relation to this. So it's their decision. So I don't interfere with those decisions. It's a matter for those officers. I think it was decided, and I have asked for a brief on it this morning, it was decided that nearly $10,000 worth of fines sends a pretty clear message, not only to that person, to everyone else in the community, how serious this is. It deals with it immediately, so we can take action straight away, not get tied up in court actions, which may take months. And the other thing to remember for these 2 persons is that they are ill. So they will now have to go through a recovery from a very serious disease and will remain in hotel quarantine, mandatory hotel quarantine, until that's sorted. So there's very strong consequences for this, so we're satisfied with that action.
Did police need to get CCTV to identify him because he wasn't giving consent?
Yeah, we had to undertake a fairly detailed investigation. I think it's fair to say that the level of cooperation we got out of them was disappointing. So we did a full investigation to identify these persons, where they've been, what they've done. And as I said yesterday, we're satisfied we now have the information to properly contact trace, which is our priority, and we're doing that. And then we wrap it up with the enforcement action, and their conduct has been dealt with appropriately.
So I won't get whole genome sequencing back till later today, and then that will assist me in determining how he acquired the infection. I can understand why they're scared. I am as well. This is clearly insufficient protection, our current hotel arrangements. We need to modify those, and as you know, the Queensland Government has been asking for a different quarantine model for many months now, and I think that needs to be seriously looked at.
Just on the NRL Hub, we've seen another breach with James Roberts going out to the First of all, what are the consequences for practice, but also overall for that club, given they have a ruling last week that they basically had their last warning that your pay is breaching the rules, making a decision.
So I wrote to the NRL last night. I'm waiting for a response as to what actually occurred. And once I've got that information, then I'll make a determination.
But can you explain why politicians have been prioritised?
Because I'm very concerned that we could have our politicians, both federal and state, come back into regional communities across the state of Queensland, and we know that as part of their role, politicians meet all sorts of people. So I'm just concerned it's quite a small group, but I would like them all to be vaccinated as soon as possible. I think this is escalating now. We have had 13 incursions of the virus into the Queensland community over the last 6 weeks. That is more than we've seen before for a long time. So I'm very worried, and most of those have been the Delta variant. So I just want to manage every single risk that I can think of as much as I can. So I wrote to both the clerks of the Parliament, the national and the state, asking that every single MP gets vaccinated, if they haven't already, remembering the vast majority of them would already have had the option to be vaccinated because they're 40 years of age or over. But there are a few who might have, so I just want it done.
So you accept that the hotel quarantine is clearly insufficient and that the COVID situation is escalating now. Do you think it's a situation of not if, but when we have a big outbreak of Delta here in Queensland?
Yeah, I'm very concerned about it. As I've said, that's why we must, as soon as any of us becomes unwell, get tested and isolate ourselves. We need to wear masks. We know they're a mitigating factor, and that's not a big ask, especially in winter in the southeast corner. I think we can all wear masks for a while and manage the risks that way. And we also have to be careful with our gatherings and who we can come into interaction with. We will review it over the next 48 hours.
Just on the NRL Hub again, do you think that hub is in jeopardy now, given we've seen?
I'd like to wait to see the response from the NRL before I make decisions. Thank you.
Concerns about hotel quarantine have anything to do with allowing those people coming to stay at home? No,
it's a different issue there. I think that the risk is significantly falling down in South Australia and Victoria, so I think we can modify our requirement and have people quarantine at home. Also, I'm actually overall very impressed with the compliance from Queenslanders. So these are Queenslanders coming home because they're the people who really can come back to our state. There's very few others who can, and we've now got more than 2,000 Queenslanders in home quarantine because they've been close contacts. So I think this group can safely quarantine at home because I'm reasonably comfortable that their compliance is very good, and we have increased compliance processes that we're now using compared to a year ago. I think we need to take fewer people from overseas, so that's already been implemented by National Cabinet. So the numbers of people from overseas has halved, and that's in place at the moment. I think that's a very good thing. That's halved our risk.
Do you think it needs to go down further though, seeing as we keep seeing these incursions?
Well, I think we need to work them through over the next week. We've got to work out what we can do to further mitigate the risks in hotel quarantine. Yes. I think we've got a lot of systems in place, and they were absolutely fine for different variants. It's now that we've got such an infectious variant that the concern has been elevated.
In terms of South Australia and Victoria getting hotspots, are there any particular restrictions that they're keeping there that are making it a hotspot in place?
Yes, and it's also the discussion that I had yesterday at AHPPC with my colleagues. So we have those discussions every single day, and I get a feeling from them as to what they think the ongoing risks are. So they haven't gone back to fully reopen to where they were before the outbreak. They've still got restrictions in place, so I think it's wise for us to keep our arrangements for a bit longer. No. We sent nurses instead of the pilot. Yes, but they were all wearing PPE and we're managing that. I would like to see it higher, of course, but it's fantastic today. To my last check, it was almost 50% of people, so they've done a really, really good job there. But the ship didn't land there. No one came off the ship there, so it's not a risk to Torres, and we'll manage it very, very carefully when it goes around to Weipa. I can't remember. It's available publicly on websites. Yeah, it's total, I can give you the figure. So across Queensland, we've now given 2.158 million doses. Some of those, of course, are second doses, most of them are first doses. I don't have that, but it's on our website. You can easily access it, Lydia. Oh, 100%, of course.
There's a push to manufacture.
That's the work that's being done by National Cabinet at the moment, so there's a lot of modelling being done that's looking at what percentage of Australians need to be vaccinated to prevent a risk of an outbreak. So that work is happening. I would like to see the modelling data. I'd like my opinion to be based on the facts.
Very good. Manufacturing.
Sorry?
Is the government doing anything to fast track the Pinkenba facility in light of what not the understanding?
Well, we have to remember the Pinkenba facility is a proposal of the Commonwealth Government. So the Commonwealth Government put this up as a site. They identified the land, and the responsibility is for the Commonwealth to outline what it is they're proposing as far as the construction and the funding of this facility. We've already put up a proposal at Wellcamp. It's a fully developed proposal that could have been fully built and already operational and is still on the table for discussions. So the Pinkenba site, I understand, has some logistical issues, but we will continue to work with the Commonwealth as to whether it's a viable option and how they intend to have this facility built and in what time frame. I mean, look, the question around vaccinations, I take Lydia's question about what level of vaccination is the right level to open up the community and the economy. The Premier has already said that we should be able to open up when every single Queenslander has access to the vaccine. Every single Queenslander. Now, I don't know, as the Health Minister standing here today, what date that is going to be. The Commonwealth has announced that they're getting millions more vaccines in 2022 and 2023. That's great, but we want our economy open up before then. So when are we going to get enough vaccines in this country that we can have every single Queenslander being able to put their hand up and say, I want to get vaccinated? Because I know for August, we are getting around 81,500 vaccines a week, each week for August. Now, we were vaccinating almost 100,000 doses only 4 weeks ago. So even with the supply we're going to get each week in August, we're not going to be able to vaccinate at the rate that we were 4 weeks ago. We're still going to have to slow down and tell people that their bookings are going to be October, November, December. So I'm asking the Commonwealth, do absolutely everything possible for you to try to source more vaccines from overseas into the country this year. Not 2022, not 2023, but now. The risk factors have changed. The variant has changed. We can see the dangerous nature and how contagious Delta variant is, and that more children are at risk as well. We don't need to wait for more deaths to act on this. We need to make sure we're getting as many Pfizer vaccines into the country right now, and I'm calling on the Prime Minister to do everything he possibly can to get it into the country right now.
Can I just check on the backpack? The backpack is hostel.
Sorry?
The backpack is hostel.
Yep.
People isolating. What's happening there?
Oh, well, as Dr. Young said, this is information we've got overnight. So contact tracing will commence today, and they will contact everyone who's been residing there over that period and any other close contacts, as we always do. So they'll be working very quickly, and we know, they're a very professional expert group who do their job exceptionally well. So they will be getting onto those close contacts. But of course, if you know you've been there since the 22nd, don't wait to be contacted. Isolate immediately, go get tested, and contact Queensland Health through the 134 COVID or our online form, and notify us that you are a close contact. Last one.
About manufacturing vaccines. Is that years down the track? What vaccine?
Well, we will do everything as a Queensland government to get manufacturing happening in this country and for vaccines to be manufactured here. The Treasurer called on this last year and said he wanted more manufacturing of vaccines happening in this country, and we will do everything to support that happening in Queensland. But that's not going to help us today and tomorrow. So it will certainly help us going forward, because we're going to be living with this for a very long time. We're going to need booster shots, and we're going to need to, just as we do with the flu every year, continue to protect our community. So we want that vaccination being manufactured here. But I want to know what's happening today. What calls, what inquiries, what is happening right now at a Commonwealth level to not just wait for the supply we're getting in October, but to get extra right now. Are we ringing up our other neighbours, our countries, our supporters, and saying, have you got extra stock? Can we get more Pfizer from you? Are they contacting Pfizer and saying, we need more right now? Our risk factor has changed. We have thousands of people who are now positive in New South Wales. We have every jurisdiction being seen to have these cases spreading, and we're seeing more happening in quarantine because hotels are not built to be containing this sort of serious virus. So we need help, and we need help in the form of more vaccines, and we need it now. Thanks, everyone. Thank you.